Welcome everyone to our part one of the presentation regarding client reminders and small media to increase cancer screening. I'm really excited about this presentation. I am not Christy Cahill. My name is Megan Phillips. I work for the Colorado Department of Public Health and Environment. And Christy is out today, so I will be filling in. So bear with me and my rookie Zoom facilitation skills after a long weekend. We are recording this. We'll make sure that everyone has access to this recording and access to any of the resources that Allie might be sharing. I will also put a link to the registration in the chat box for part two, which is happening later this month on June 28th. I think that this is a really nice progression of these two evidence-based interventions that a lot of our clinic partners have been implementing or are currently implementing. So I'm excited about being able to help be a part of this. A few housekeeping items. We are recording this. If you are enjoying your lunch, good for you for taking care of yourself. Just make sure that you are on mute. If you have any questions throughout the presentation, go ahead and put them in the chat. We'll have plenty of time for discussion and question and answering of those at the end of the presentation. And if you have any questions regarding tech issues, or if you can't hear either myself or Allie, feel free to chat me privately and I will do my best to troubleshoot. I think that's it. I will hand this off to you, Allie.
Awesome. Thanks, Meg. And thanks everybody for joining after the long weekend. Meg and I were just chatting before this and we were like, why did we schedule this the day after a long weekend? But this is a super exciting topic. I'm a huge public health nerd, so I love kind of sharing this with everybody. So I work for the American Cancer Society. I'm a Cancer Control Strategic Partnerships Manager, and I'm also the current chair of the Cancer Coalition. So I see a lot of familiar names on the attendee list. So yeah, looking forward to this. So let's see if I can advance this here. All right, so just to kind of get to know who all's on the call, if you would please share in the chat your name, your organization, and kind of where you're at right now with client reminders or small media. Is your clinic or organization currently implementing anything? Would you like to? Just kind of what your interest is in these two topics. And while everyone's doing that, I'm going to go ahead and just do a little bit of a level set about a few things here. So as Meg mentioned, this is a two-part series. We thought that that would be a little bit more enjoyable for everyone than 2 hours of listening to me talk. So we broke it up. So we have today, and then we have June 28th for part two. So today we're really going to be talking about what these two interventions are and what they look like, how to implement them, kind of some tips and things to consider whenever we are building these interventions. And then on the 28th will be what I'll call the more fun part of the series, where we'll dive into what resources are available, what kind of plug and play things already exist that you can co-brand, that you can personalize, what messaging resonates with different populations and different people's motivations. And so, yeah, it should, like Meg said, hopefully these are a really good kind of part one, part two to introduce everybody to these. So I'm seeing palm cards. We're not using reminders. Luma. Patient outreach and education. Awesome. So it kind of sounds like we have a little bit of kind of across the spectrum with folks that are doing stuff with digital platforms and folks that just kind of want to get more involved. So great. So again, just to kind of level set a little bit. So what do we need to do to successfully implement evidence-based interventions? So this is kind of the spectrum, the timeline that we use whenever we are working with a group and building out these interventions. So today we're really going to be focusing on the create the action plan. What do these EBIs look like? And then how we can customize them kind of in the exploring processes and gaps to customize and test EBIs. And then one thing that I will mention is kind of health equity plays a huge role in this. I think oftentimes people choose to implement small media and client reminders because they seem relatively easy. You know, we're going to mail a letter or we're going to hand out a flyer to everyone. But thinking about how health equity fits into this and making sure that we really are providing tools and resources based on the needs of our patients to allow everybody to be as healthy as possible. So that will be important as we talk a little bit more about the specifics. And then the community guide. So the community guide is the group that really helps to build the evidence for what works, including all of our cancer screening initiatives. So I'm a huge, it's not broke, don't fix it, let's not recreate the wheel. And so the community guide looks at all the research that has been done around a particular intervention and decides whether or not it should be recommended. So I'm sure that some of you have seen this slide before. So this is all of the interventions that the community guide has reviewed. And then based on that, they either recommend, there's insufficient evidence, or they recommend against. So you can see for client reminders, breast, cervical, and colorectal cancer screening is recommended, and the same for small media. So that's going to be what we're talk a little bit about today. And then with the insufficient evidence, what that means is that there's not enough evidence. So it doesn't mean that it doesn't work. It just means that we need more research to up it to the recommended status. All right, so let's go ahead and dive right in here. So first we're going to talk about small media. So small media includes videos or printed materials such as letters, brochures, and newsletters. So that is obviously a very, very broad category. So when we think about small media, that can mean a lot of things. And so I think as we explore this a little bit more, we'll kind of see how these can be tailored and personalized to really meet the needs of populations. And one thing I will note, some of these slides are kind of wordy, but we will share the slides after the presentation so that you can go back and reference anything that you need. And then, so as I mentioned, the small media is recommended for breast, cervical, and colorectal, but colorectal gets a little bit of an asterisk. And so the current research is based on stool testing. So there's insufficient evidence to determine the effectiveness of small media to increase colorectal cancer screening by any other screening modality than stool testing. So again, that doesn't mean that it doesn't work. It just means that more research is needed. So why do we use small media? So based on the research from the community guide, we know that small media interventions increase breast cancer screening by an average of 7%, cervical cancer screening by an average of 4.5%, and colorectal cancer screening via stool testing by 12.5%. So when we're thinking about screening rates for our clinic, these can make a huge difference, especially if our screening rates are low. So the first thing to think about whenever we're thinking about small media, going back to that health equity point, is, who are our patients and how do we reach them? What reading level do we need to have materials at? What is the health literacy? If you send somebody a letter in the mail and say that they're due for their fecal immunochemical test, do they even know what that is? So thinking about the words that we use and the reading level. And then of course, language. We know that there are a lot of languages spoken in Colorado. So we want to make sure that we are reaching out to folks in the language that they can read or understand. Motivation. So we know that there's a lot of different factors that motivate people depending on their culture, where they're at, their barriers, and then insurance status, of course. And then I think one thing that we often don't think about is how people's different identities intersect with one another and how people have multiple identities. So it could be someone that's insured, speaks Spanish, and is a single mother. And so all of those certain things really create additional barriers, challenges that we need to make sure that we address appropriately. And then when we think about what do our patients need to know? Are we talking about test options, pros and cons of testing, like the risks? What is the test like? There's a lot of misconceptions about the pain involved with a mammogram or the prep involved with colorectal cancer screening. And so, really making sure that people understand, what the test is like and what the expectations are can really help to eliminate some of those fears. And then also myths about tests. So I know pretty frequently we only hear the bad stories about a colonoscopy. No one goes and tells all their friends that their sister had a great experience with her colonoscopy very often. So I think dispelling the myths in some of these small media can also be really helpful. And of course, cost and insurance coverage. So, if someone is insured, they may be eligible for the Women's Wellness Connection, or they may be eligible for a lower cost test, like a stool-based test. And so making sure that people really understand what they need to know through our small media, and that we're really educating folks on things that will really encourage them and motivate them to get screened. And then how is the information conveyed? So this is kind of gets back to that small media can be a lot of things. So it could be an infographic. It could be an animated video with subtitles. It could be a video from a healthcare provider. We know that provider recommendation is one of the things that gets people to get screened. So maybe a video from a healthcare provider. Detailed descriptions. So we can see on the slide that these are pretty detailed descriptions of each of the colorectal cancer screening test options, so that folks can really understand what each test looks like and what kind of the pros and cons of each are. And then determining whether or not we do something simple or something more elaborate. So we know that folks that have been screened previously are more likely to get screened with a small media or client reminder. So they might not need an elaborate message. They just might need a, hey, it's time for your screening. So thinking about that based on our population can be really important too. All right, so here are some small media examples. Again, we'll dive into more of these in part 2, but just thinking about how do we tailor to our specific populations. So obviously these 4 kind of buckets at the top are not all inclusive of what a clinic population would look like, but hopefully this can provide you a little bit of kind of an example of how to tailor things. So if we have an uninsured population at average risk, we might provide them with small media that would include a flyer around reduced cost stool test options, and then follow-up colonoscopy resources. For an insured population, so that could be Medicare and Medicaid, we could provide them with a flyer with all of the screening options that would be covered by their insurance, including information about, if you do have a positive stool test and you need a follow-up colonoscopy, then you might have to pay for that. And then the same kind of uninsured, insured, but for folks that are Spanish speaking. So are we making sure that we're meeting our language needs of our patients with, a flyer with all the pros and cons in Spanish, and a flyer about reduced cost stool test options, and also including information about follow-up colonoscopy resources with Spanish speaking staff. So If I do need a follow-up colonoscopy, who can I call that will be able to speak with me in Spanish? So those are just kind of some broad examples of kind of how you could lay this out if you were thinking about how to do this with your complete patient population. And then workflows. Like I said, I think that often small media gets chosen as an EBI because it seems easy. But if you don't implement it to meet the needs of your population in kind of an intentional way, you're not very likely to be successful. And whenever you're creating a video or printing a lot, that can get really expensive. So you want to make sure that you really have workflows in place, that everybody is on board, that we understand what we're doing, so that really we can get that return on investment and increase screening rates. So this is just a little bit of an example. Again, I didn't want to make a huge workflow example that would take up the whole screen, but in this example, each morning the office manager identifies the days patients who are due for colorectal cancer screening, kind of which of the small media they will receive, and then that's shared with the clinic team during the morning huddle. And so for this particular example, an iPad with a video is being used. So the front desk provides the patient with the iPad to watch this video that has subtitles while they're in the waiting room, and then they'll have the opportunity to discuss colorectal cancer screening with their providers. So the patient watches the video, and then the rooming staff, so whether it's an MA or a nurse or kind of whatever the setup is in the clinic, asks the patient if they have any questions, provides them any additional education that they might need, and then they ask them to complete a short 3-question survey about the video. So one thing with small media is it's really hard to evaluate because there's a lot of differing factors. A lot of times it's combined with other interventions. So thinking about how can we get feedback from patients about, is this working? Do you like this? Can be really important. And then the provider recommends colorectal cancer screening as a part of their visit. And then the patient is provided with a fit test with instructions or is scheduled for referral for colonoscopy at checkout. So thinking about how kind of the addition of that small media can fit into an already existing workflow can be really helpful. All right, client reminders. So client reminders are written or telephone messages. Again, there's a lot of opportunity here. Excuse me, a letter, a postcard, an email. Telephone messages can be automated. And what this is it is advising people that they are due for screening. It's not a reminder about an existing appointment. It's not a reminder about a cancer screening appointment that has already been scheduled. These are really designed for folks that are due for screening that do not have appointments currently scheduled. So after you do the client reminder, you can do the follow-up reminder for the visit. You can assist in scheduling appointments. And then you can also do something like the addition of a small media that can provide some additional education about the screening test that the person is due for. So for the data around this, we see that breast cancer screenings are increased by 12% on average, cervical cancer screenings by 10%, and colorectal cancer screenings by 10%. So we definitely see that reminding folks that they're due for screening can have a huge impact. So types of reminders. So we know, and some of you guys mentioned kind of in the introductions, that you have a messaging service that you use. So this could be through your EHR app or online platform. You can mail letters and be kind of old school. Postcards, this is commonly done like when someone turns a screening age. So for someone's 45th birthday, they could receive a postcard that says, "Happy birthday, it's time for your colorectal cancer screening." Automated messages, so those are kind of the pre-recorded ones. which can be helpful if you have kind of a standard message that you want to send out to a group. Personal phone calls. This is great for folks that have a lot of barriers or that need additional kind of navigation, and then text messages. So one thing when we think about client reminders is, back to the health equity point, is not everybody needs the same message, and people need different messages, and you need to meet people where they're at. So a lot of times with client reminders, we will suggest that you prioritize your patient population. Not only is this really helpful from a capacity standpoint, if you send a reminder to all of your patients, do you have the capacity to answer those phone calls, to get all those people scheduled? But how can we make sure the folks that have the highest need are seen the soonest? So when we think about prioritizing patients, there's a lot of different things that we could do. So we can do it by highest risk. So if we know that people have had needed a diagnostic mammogram in the past, maybe those are the folks that we prioritize to get back in for screening first, or people with family history, people that haven't previously been screened. So if people are very long overdue for screening, maybe that's a population we prioritize. Again, with the newly eligible, so maybe we can get those folks in quickly. The last interaction with the health system. So this is kind of a key one if you want to do any kind of mailed or even with a text message or an automated phone call. Folks that you have frequently interacted with or interacted with recently, hopefully that will mean that you have more up-to-date address and phone information from them. Insurance status. We know that there's a lot less barriers for folks with insurance than folks without insurance. The general number of barriers. So if you do any kind of like social determinant of health assessment or anything like that, you can use that data to help prioritize patients. And then the use of an app or online platform. So if you have access to those people through the app or online platform, it's very easy to send them a message. So what does the message say? So again, we want it to be tailored to those specific populations. If we know that creating additional messages can be more expensive, but we also know that if the message doesn't resonate with somebody, they're not as likely to get screened. So we want to address the motivations. We want to address the barriers. So maybe it's there is a lower cost stool test available for colorectal cancer screening, or maybe there is transportation available to take you to your mammogram. We want to make sure that it includes an action like schedule here or call here. So I just think about me personally, if I get a postcard in the mail that says you're due for your cancer screening, you know, that's okay, now I know that. But if it says call us now, I'm a lot more likely to kind of take action if that action is directly included in there. Make the case for early detection. So we know that a lot of fear can come with cancer screening because we're potentially detecting cancer. So when we're talking about the importance of early detection when it comes to treatment and survival, that message can really resonate with folks. Eliminating real or perceived barriers. Cost is a big one with that. So making sure people understand, you know, that there are programs that can help them. And then engaging family and community networks. So we know that a lot of populations and cultures really want their health focus to be on their family and communities. So if that is a motivation for a population, talking about being around to take care of your family or being a part of your community can help to really motivate folks too. So here's some tips. So test your messages. You have people coming into your clinic every day that fit within these populations. So So ask them, would this motivate you to get screened? Would this motivate you to get screened? And really make sure that, again, you're not wasting money doing these reminders, not knowing if they'll work for your populations. Align health systems with consistent messaging. So make sure that your front desk staff knows that these are being sent out and what the messaging is, that all of your clinical staff does. If you have a call center that you work with, make sure no matter who a patient talks to after receiving a reminder, that everybody's on the same page with what this looks like. And then make an evaluation plan. So this is a graphic from the CDC that kind of talks about some different ways that you can implement client reminders and what the evaluation plan for each kind of component looks like. So again, implementing into a workflow, we'll look at a workflow in just a second. And then whenever you send a reminder, how many of them are actually received? So if you get undeliverables from emails, or if you get no forwarding address, if you're mailing stuff, make sure that you're documenting that, because that, that's part of the evaluation. And then with people that actually make appointments. So, and not only make appointments, but keep the appointment. So, that is a direct output from the client reminder. Did they schedule an appointment? Did they keep the appointment? And then completing cancer screening. And then of course, clinic level outcome that we're looking for is the overall increased cancer screening. So these have some examples that could be helpful as you're starting to build kind of your evaluation plan for your client reminders. So here's an example workflow. This looks a little bit fuzzy. So this would be for existing patients. Project manager pulls a report from EHR to determine age eligible patients due for screening, and then they send a letter to them. And then there's three kind of options here. So the letters returned to the clinic. So back to the having updated addresses. A patient is unresponsive. And then if a patient is responsive, and then kind of what the clinic does from there on out. So again, that's a very simplified version, but I can give you an idea of things to make sure that you include. And then another thing to think about is kind of a timeline. So what does this look like over a period of time, knowing that we're not going to be sending a reminder to every person that's due for cancer screening, especially when we're talking about breast, cervical, and colorectal. That could be a huge percentage of our patient population that we don't have the capacity to take care of them all at one time, or even to answer the phone if they call. So this is just an example of what a timeline could look like around what the particular prioritized population is and what the chosen reminder looks like. So whether it's a text message, a personal phone call for somebody that's high risk, really stressing the importance of that, making sure that we have reminders in appropriate languages, and then back to that kind of interaction with the health system. All right. So that is kind of the quick high-level overview of those two interventions. Sorry, I'm reading the chat at the same time. So does anybody have any questions right off the bat? And if not, we will hop into some discussion here if there's not any questions. So you can feel free to take yourself off mute to participate in this. You can add your thoughts and comments in the chat, whatever is kind of the easiest for you. So Meg, is there anything in the chat that I missed?
I don't think so. I think everyone is really excited about the development and the utilization of these resources. So just a reminder that we will have a part 2 of this discussion that will go over more in depth resources that ACS has developed. So registration is in your chat, but I think we are all set from a question standpoint.
And I do kind of feel like that part one is very much like a teaser for part two, because like I said, that's kind of where we get into like the fun of like, what does this look like and what are our options, and how many languages does this come in, which I think is a lot more fun than kind of the science and the why are we doing this. Oh, Jamie. So Jamie, it's ironic that you're asking me to talk about lung cancer screening, since you are certainly the expert on this. So kind of on the lung cancer standpoint, we know that lung cancer screening is obviously a lot newer than the three cancer screenings that have been kind of discussed in this presentation. But we actually talked a little bit about this when we were planning for this, and can it be assumed that these interventions will likely work for lung cancer screening? And from a cancer screening standpoint, I would say probably, but Jamie, I'm certainly be interested to hear your thoughts.
Sorry, Ali, I had to take myself off mute and
No
get
worries.
the right buttons. But I do think that some of the basic principles will work, because they're all about patient engagement and trying to provide people with the information and options that best help them. That being said, I don't think they'll work as well in the lung cancer screening community, because we don't have that established years and years and decades of trust and awareness of lung cancer screening. So I tend to think that in order to increase uptake and informed uptake and longer term adherence, it's going to take more of an engagement effort and multiple strategies, as well as a little bit more hands-on. I just don't think our community is going to respond as well to postcard reminders, particularly early on, until we establish lung cancer screening as a social norm, and much more like the other cancer screenings. But until then, we're kind of the new kid on the block, and might require a lot more high touch interventions, telephone calls, encouragement to go along with some of the other things. But the evidence is still emerging as to whether we can really extrapolate or not.
Awesome. Thanks, Jamie. All right. So let's hop into kind of more specific discussion questions here. So similarly to kind of what we shared in the introduction, who is currently using client reminders or small media interventions, and how are you implementing these interventions? So it sounds like some clinics are doing some great work. Is there anybody that wants to come off mute and kind of share their experience, or maybe something that I shared today that really resonated with you? Do we have any volunteers?
Hey, Allie, it's Randy up in Wyoming.
Hey, Randy.
So we just did a project with Cigna Insurance, focusing on all of the state employees and doing colorectal, cervical, and breast cancer screening reminders. We sent those out last year, and we did see about a 1% uptick after 6 months in people getting their cancer screenings, which is great considering we were in the middle of a pandemic and a lot of people weren't doing anything. So we're looking forward to getting our 1-year results coming up this summer. Cigna will be pulling that information. So we're optimistic and hopeful that we'll see a pretty good uptick, but it's encouraging. And we plan to expand that program, not just with the state employees, but other large groups that Cigna works with, and then also expanding with Blue Cross Blue Shield, another large insurance carrier in the state. So we're
Awesome.
excited.
Yeah, that's great. And I think that that's one thing to think about too. Any organization that has access to patients or clients can send client reminders. It doesn't have to be just from a clinic. So those are great examples.
Hi, Allie and everyone. This is Kate North. This is just my voice. Sorry, not my face, but I don't have a very good internet connection, so that just causes problems.
No worries. Hi, Kate.
Hi, and I am the non-medical professional in this group. I am a breast cancer survivor for 20 years. I've been living with metastatic breast cancer for almost 5 years now, so I'm one of the good stories.
Yeah.
But I also know just how important screening and monitoring your health is. So I just have two recommendations to this group. One is as a patient, and also professionally, I do marketing work. So I'll also give you just a bit of marketing advice. So from the patient perspective, you might consider trying to put in like a patient story. Like Kate is, doing well, and she knows how important early screening is because that's the reason she's doing well. Whatever it is, just get like a little patient testimonial, snippet, something that shows that you're really thinking of them, on those terms. I think that would be something worth considering. And then as a marketer, for sure, and in marketing, we call it a CTA, or a call to action. You have to give them very specific and easy, here's what you do. You call this number. You send this email with a link, if it's digital, whatever it is, you make it very easy and clear on what it is that they have to do. And also on the motivation, a lot of studies have shown that human beings are much more attuned to loss than to gain. So even though you want to paint it, I think, in a positive way of what you're going to gain, there's also this message about loss aversion. And it's a tricky one, I think, for something like this, because literally, the loss, could be your life. But I think to put it in terms of just quality of life and staying healthy and being able to have as much time as possible with your loved ones, and that kind of positive spin on what a loss aversion could be.
Yeah, that's great, Kate. And I think that goes back to a little bit that engaging family and community. So making people realize, if they don't do this, they could lose their life. And what would that mean to their family and their community? So yeah, I think that's spot on.
Yeah, and again, I might be careful about like losing your life, but just couching it more in terms of quality of life and staying healthy. We all want to stay healthy to enjoy to enjoy the time that we have.
Ashley, would you be willing to share a little bit about what your letters that you guys are doing at Denver Health with addressing patient gaps in care?
Hi, Allie. Hi, everyone. Yes, you bet. And first of all, I just want to start off with saying, just in this talk, hearing kind of what I think we're not doing so well at my organization. Maybe we're casting the net too wide and sending letters to small media reminders to just like the big net of everyone who's overdue for mammography or cervical cancer screening. So this presentation has really given me a lot to think about in terms of like how we can just whittle that down and give like really focused messaging to the uninsured would get a certain message, and people, we definitely have a lot of opportunity to refine that. So I'm really glad that I attended this presentation. But going to your question, Allie, about the letters that we are sending, essentially, It's a letter template that collects all the gaps in care that patient has. So if there's somebody who has diabetes, then that letter might also be saying that they're due for their hemoglobin A1C test. And if they're also due for their breast cancer screening, that letter would also contain that information. And it's, you know, it's trying to be a little bit more visual with kind of doing a little bit of a stoplight kind of thing. Like if they're overdue for that particular test, then it's red. If it's getting close to being overdue, it's yellow. If they're up to date with it, then it's green. So really it takes just a group of gaps in care and sends a letter for where they're at with each of those, just to kind of it's kind of like a summary of where they're at with their preventive care tests.
That's great. Does anybody else want to share what they're currently doing for either of these?
Allie, I think I would also encourage everyone to think about, when implementing these evidence-based interventions, what does sustainability look like, knowing that mailings are often expensive and are hard to do from a time resource standpoint. How can you leverage, you know, if you're a clinic, your electronic health records? I know some clinics have had really great success in implementing, you know, a specific or focused messaging that supports, you know, health equity within their community, but also how can you leverage the work that, you know, Ashley was just sharing in terms of all preventive maintenance, in terms of, you know, care and where they are in their health standing.
Yeah, that's a great point, Megan. I think coordinating all of that can be important too, especially with other programs. Because if you are sending somebody 10 client reminders, that's just going to be completely overwhelming to the patient. So thinking about how to be efficient and coordinate that is a great idea.
Hey, Alan.
Hey, Guadalupe.
Hi. You can just call me Lupe. It's that's a mouthful. I know. We utilize the EHR recall system in our program. So we can filter out and look at month by month who is coming up on a recall, so that we just filter them out and we start calling and reminding them. We have a system whereas we call 3 times and send out a letter. And then that's that. Plus, on top of that, we have all the different Salud clinics, except for the really like Trinidad, maybe Estes Park. We do get a lot of Estes Park, but some of the further, like Aurora, let's say, we don't necessarily get that many referrals to the Longmont Clinic, to us here, but we are inundated by folks that need to get in. We have way too many and it's hard to get them all through. I think the biggest issue is going to be language barrier and uninsured. Those are the 2 big, huge barriers for our clientele. And so with the uninsured, it can oftentimes take us, 6 months to get them through, to get them on a program so that we can work with them depending on their documentation status and whatnot. But the language barrier and the uninsurability is huge with us. We blast through the commercials, Medicaid, Medicare. We get them in, get them out. But boy, everybody else takes forever to get through. So we always have this excess number of people we're trying to, put through the chute to get them through, So I love hearing everything that everybody has. We also use Luma, but not so much as a reminder, but maybe as a reminder for having their clinic consults, but not for once they're set up. at the hospital with Dr. Elzinga. That is very, very much a manual effort to confirm and get them all squared away with who needs a COVID test and who doesn't need a COVID test, and who needs to bring their vaccination card and who doesn't need to bring their vaccination card. There's so many little steps, but we have a pretty tight-knit group here that we work with, and they're all wonderful. But we do get referrals to have them see Dr. Elzinga from Fort Morgan, Sterling, Estes Park, Fort Lupton, Frederick. I mean, they're from all over the place coming straight to Longmont. And they love him, and they come a very long ways just to see him over and over again.
Yeah, Lupe, I really like a lot of those comments. So you saying that, the folks with insurance, you just put them through the chute, like that's one thing to think about when you're prioritizing your patients is, who will be easy, and then thinking about the folks that really need that high touch navigation, like the people that are uninsured, that have all the barriers, that need to be spoken to in Spanish, and figuring out how we can address their needs. So yeah, I think that's all great. I understand that there's huge challenges with that, but it sounds like you guys have a great system in place.
Yeah, they're a good bunch to work with.
Yeah.
As you guys are. This is wonderful. I love this.
Great. All right, so Lupe kind of started us on the next question with challenges. And so down here in my word bubble, I think it encompasses a lot of the challenges that we see with these two things. But does somebody want to share a challenge that they're having, and see if we can get any kind of thoughts from any other participants, or is there anything from the presentation that brought out any challenges, kind of so what Ashley was mentioning, or any just general thoughts from anybody?
I can start us off regarding challenges, Allie. Sometimes the clinics that I work with often have challenges regarding measurement of impact in terms of completion of screening. If you implement this intervention, what is this going to look like? Knowing that oftentimes client reminders in small media or certain types of evidence-based interventions often work really well when they're implemented with other evidence-based interventions. Lupe brought up a good point also surrounding, the multiple touch points that you have to have within certain populations, and how does that relate to screening?
Does anybody have any thoughts on that for things that have been successful around kind of evaluating interventions, especially whenever you're implementing multiple interventions at one time?
I'm sorry, it's Lupe again. I'll just say that we have to be so culturally sensitive. We have such a diverse clientele here. It's all the salutes. It's amazing. You just think, oh gee, it's time, come on, get it over with. There's a lot of stuff going on there. You have to, oh, look at the white dog back there. just photobomb. So there's just so much that you have to unpack in order to not just say, oh, you must not want this, or, make the time, or just whatever. You really do have to stand back and go, there is a cultural thing that we need to work on here, because of a lot of times it's just, they had a family member that was very ill and they don't want to have to go through it. We'll get people all the way through to where they're scheduled, and then they just call out at the very last minute, no show or cancel or want to reschedule over and over and over. And I think so many times they're just scared, and you just have to sit down with them and you have to explain it again, and you have to bring it down to their level, whatever the heck their level is, because sometimes you have no clue what's going on. But many times, if you just really start talking to them, they understand, they feel a lot better, and they just don't understand, you know, propofol versus conscious sedation. They don't understand that. They have no idea. They think they're going to have a tube down their throat, and it's just like, no, 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 you're not, and this is what's going to happen. Obviously, transportation's a big barrier, but the whole cultural thing with us, I mean, the guys don't want to have it done. Men do not want to have a colonoscopy, especially Hispanic men do not want to have a colonoscopy. So it's tough getting them to buy into this. You know, it's something that's necessary, and I promise you, we'll take care of you. And there is, you know, you're not sitting in front of a TV, you know, camera or so. I don't know what they think, but so many times you're like, this isn't an arena event, you know, this is just you, the doctor, and a tech, basically, and a nurse, you know, but they come up with all these weird ideas. I was thinking of something else, but I forgot. Oh, I'm sorry. Never mind.
Yeah, and I think just addressing people's concerns with that personal touch can really have a lot of impact, especially for folks that are high risk and really need the test done. We have a comment in the chat from Joyce, who has a very clean keyboard now, about wanting information about Cologuard versus colonoscopy. So yes, we will get into that in part 2. So sorry to be a complete teaser. I can certainly send what ACS has put together before then. But that's kind of exactly what we'll be getting into in part 2. So if there's specific resources that you're looking for, like Cologuard versus colonoscopy, or what are all of the colorectal cancer screening tests, if there's specific resources that you are looking for, you know, if you, is there a video about this? If you guys want to put anything like that in the chat, I can try and round up as much stuff as I can for part 2 to share with everyone. All right, and then my last question here in our last couple of minutes is just, is there any other questions that anybody has, or anything that anybody wants to share? You guys feel like that this was helpful? I realized that it was very quick and very high level, just knowing that we don't have a ton of time. Now everybody's quiet, so it must be lunchtime. All right. Awesome. I'm glad that it was helpful. All right. Well, here is the part 2 information. I think Meg will, yeah, thanks, Meg. So in the chat, Meg just put the registration link for part 2. So again, we'll be talking more specifically about messaging and motivation and what resources are available, targeting specific populations. So ACS has done a ton of research on this, specifically around colorectal cancer, but we also have some messages for other cancer screenings as well, based on populations, motivation, insurance status, just people that are procrastinators, older populations versus younger populations. Yes, Patty, I'll put that on my list. We definitely have a lot of resources around that. Thanks, Terry. Yeah, thanks to all my Wyoming friends that joined. So.
All right. Thank you, Allie. That was incredibly informative, and I'm really excited about part 2. I think I will follow up with Christy, but this, like I said at the beginning, this meeting was recorded. So we will make sure to get this out through the coalition and through the CPED and CCSP newsletters. And then stay tuned for part 2, that is June 28th. I think that there's going to be a lot of pieces that you can take away and resources that you'll be able to use in all aspects of your work in supporting cancer screening. So thank you, Allie. You did wonderful. And I am excited about the next webinar.
Awesome. Thanks everybody for joining.